Hello guys, welcome to my video. And in this video, I'll be telling about the importance of UPSC CMSE exam. And before that, let me introduce myself. I am Dr. Bhargav Teja. I belong to UPSC 2020 IRHS cadre, and I have done my MBBS from Government Medical College Anantapur, 2K14 batch. And right now, I am in my MS Orthopedics from Calicut Medical College. And in this video, I've been explaining about the importance of the UPSC CMSE exam. Coming to the UPSC CMSE, this exam has been conducted every year conducting by the Union Public Service Commission. It's a government body which usually it will conduct exam for civil services, engineering services, and CBA and very major exams for the country. And this every year they will release a calendar in the initial phase of a year. Usually in January we'll be getting the calendar so that you'll be able to know the date of medical services entrance exam. So that won't be changing since from the past 5 to 6 years there has not been any change. Even in the coming to the pattern of the exam will be conducted in two stages. Stage 1 will be like paper 1 and paper 2, which is a MCQ based exam. In paper 1 it includes 120 questions, and paper 2 which will be in the second half of the session, second half of the day, which includes some 120 questions. And coming to the personality test, after clearing this, you will be getting a result after clearing MCQ based exam within a 1 month, so that you will be able to. They will choose 1:3 ratio. If you have a vacancies of some 300, then some 900 people will be opted for the interview, and they will be called for the interview in the next phases. If you clear your personality test, and then one final list will be delivered. In that final list, they'll start doing medical exams and certificate submissions, and things will go on. I'll clearly explain this in the coming videos, next coming cadres, where you will get your postings and all. I'll be explaining in the further videos. And this is how the exam pattern from the day of from your first exam to the your date of appointment. Almost it will be a time span of some 15 months, so that you will be flexible enough to convert your preparation. And who are all the eligible people for this exam is like every medical graduate who got their provisional degrees and medical degrees are eligible for this exam. And especially for especially for people who are studying in a final year also will be eligible for this exam, so that by the time of your interview you should be able to produce your certificates of your professional degree or either a medical degree. If you have failed to submit, then your job will be you'll be given an extension of some for 6 months, so that you will be able to produce. Otherwise, you will lose your job. And why I'm stressing to refer UPSC CMSE over NEET PG, because like every one of us are spoon fed from our first year of MBBS. Like we have to do a post graduation, and next we have to go for super specialization. And every one of us know like corresponding our childhood friends and everyone who are joined the engineering services and started accountancy. Everyone they have started earning from the age of early ages. And the NEET PG will be conducting by medical bodies like MCA and NMC. Since from the past 4 to 5 years, we've been seeing this utter negligence from the medical bodies, so that exam date will be given someday and exam will be conducting after some 3 to 4 months. We won't be able to assess when will be the exam date and all. Just because of these things, all the medical aspirants are going into a deep depression, so that many of them are giving their exam up. So just to deviate from all this, this exam will be such a keen option for them, so that we can go for that. And after joining this thing, one thing I can assure you is like if you join for your NEET PG, I can't assure you like you will be landing up in some government service or you will join some government service. But definitely one thing is if you join this service, you will be ending up in being some specialist. Why? Because you'll be having a lot of sponsorship options, including like if you do for some 3 to 5 years, and you will be sponsored for the central institutes like AIIMS, JIPMER. And if you are an IRHS cadre, then you will be sponsored. You will be sent for DNB quota. DNB quota sponsorship will be included in this. You'll be having some railway hospitals where you'll be able to get clinical branches from very high ranks. And if you are already a PG holder, if you wanted to join this service, starting your service from day one. But if you join with MBBS, and if you are in PG doing still, if you are still continuing your PG, then you will be able to get that extension, so that at least after completion of your PG, you'll be able to come and join. So this option of extension has been kept on modifying, but right now the extension is still active. So even after you are joining, of PG, you can ask for extension and you can come back for the service. And compared to the job satisfaction, it will be like some 50% kind of. You will be 50% of administrator and as well as 50% of a doctor, so that you will be able to treat the patient as well as you have to manage the hospital and the administration works. After joining the job, what will be your job profile? Your job profile and job hours include will be a 6 hours duty every day. If you are in a CGHS cadre, the timings will be from 8 to 2, and if you are in a railways cadre, the timings will be from 9 to 4, 9 to 2, from 4 to 6. or like 9 to 4 in a single session. So this how the timings will differ, but still 6 hours per day will be almost same timings all over the services. And along with that, the leaves and all the privileges which you will be getting will be almost equal in the CGHS and railways cadre. So that you will be getting your fixed earned leaves. There will be average pay, leaves on average pay and half leave per average pay, and you will be getting a gazetted holidays and weekend offs. And if almost the timings will be same, but if you are in an Indian railway cadre, there will be some district centers, there will be tertiary centers, tertiary health hospitals, like example of some divisional hospitals or zonal hospitals. In those hospitals, you have to manage the casualty so that you will be having night duties and all. And if you are in some in CGHS, there are some maternity hospitals, and so if you are in if you are posted in such a hospitals, then you should be looking after the night duties and all. And coming to the place of posting, CGHS cadre and MCD and NTMC, definitely you will be lining up taking jobs from Delhi. And CHS, most of the CHS will be posted from the Delhi, and CGHS will be posted upon, throughout the country, where you'll be having some dispensary hospitals and VIP duties and some airport, harbor, some kind of. There are almost some 150 to 200 hospitals which are managed by the central government. So you'll be posted according to that. And in IRHS cadre, it differs from tier 1 tier 2 city. If you are a specialist, definitely you'll be posted in a tier 1 city. And if you are MBBS, you'll be sent out for the duties in some health units or in a divisional line of hospitals. Accommodation will be posted in a 2 BHK, which is almost a bungalow. And coming to the salaries, the salaries will be almost equal for every entry level servant, even if you have services or in the medical services. Then your entry basically will be 56,100. Along with that, you will be getting a traveling allowance. Your co-officers will be some engineering department, mechanical department, or some other department. Almost you will be working in equally on par with them. And you also will be encountering with the people who just within few months they have missed their college services, police services. They will be joining the railway services, and they will be your neighbors, and that interaction will be proper. And the hierarchy and the colleagues, this up and down differences always will be there. Why? Because seniors team, the seniors will be obviously more respected. Why? Because every 4 years once you will be keep on getting promotions. If you are an assistant divisional medical officer and you will be going to divisional medical officer, or in case of CGHS cadre, will be like senior medical officer and senior medical superintendent, and that will keep on going. So seniors obviously will be getting more salary and more respected. And coming to the privileges, we're getting a lot of privileges. For example, like for a servant and his family, all the medical facilities will be free for a hospital which is tied up for your hospital. For example, in a IRHS cadre, for every community health center or in a divisional railway hospital, there are a lot of private hospitals will be tied up, so that you'll be able to get the free medical facilities from that hospitals. And for a central government kids and all, they will be eligible for Kendriya Vidyalaya. And there are a lot of many more options. And for in IFS card, we'll be getting the train passes, holiday homes, and some lot of. I'll be explaining clearly in the further videos regarding the IFS card and all. And what will be the future position for the central government services? Definitely, your job will be secured. So, by my 25 years of age, 24 years of age, I joined in my service. So, up to your return will be at 65. So, for the next 40 years, you'll be secured. And the recently approved unified pension scheme, you will be eligible, so that you need not to bother about the post retirement and all. And there will be the provident fund will be keep on accumulating, so that you will be able to take an ample amount of money at the end. And actually, the real circumstances what every undergraduate has been going on is like for 50,000 or 60,000 is the hardly salary previous graduate has been earning in the tier 1 cities or in a tier 2 or tier 3 cities. That is the maximum thing. But for MBBS level, definitely this exam will be a boom. Then for a postgraduates, right now in CMSE services, there are a lot of postgraduates has been appearing. Just because unable to bear the competition and stressful life, over the professional ethics has been losing day by day. And you've been asked to write many instructions and make presentations to do more bills and all. There are a lot of some unethical activities has been going in the private practice, so that people are more stressed out. And in this scenario, definitely this will be the good thing. And one more, the biggest demerit, the entire scenario will be like, especially this will be for the people of southern states. Why? Because already most of the CGHS as well as railway cadres are almost running out of vacancies. Why? Because in the past some 3 to 4 years, all the servants who have been in service are approved for their PGs, so that they have left for PGs. Their job are unable to replace from the new entry level servants. Their jobs are kept for themselves. That's why all the southern jobs are still running out of vacancies. And if you are okay with that, if you are ready to wait for some 5 to 10 more years, in all the waiting lists will get cleared. In the next up to 5 to 10 years, definitely will be coming to your places. But that's not good. Comparatively, Indian Railways from the past to 3 to 4 years, hardly were getting postings in the south. Apart from this, rest everything is at par when compared to the NEET PG. So definitely, this will be a very good option as a backup for you. And regarding this, how to prepare for the interview and how to prepare for the entrance test, and how I have experience in the Railway Academy, my IRHS cadre, compared to the CHS cadre, I will be explaining in the further videos. So keep following and keep supporting me. Thank you.